Hello everyone, I'm Dr. Fabio Castiglione, consultant urologist and andrologist based in London. Today we'll dive into the details of microsurgical varicocelectomy, a highly effective treatment for varicocele. If you've been diagnosed with varicocele or are considering this procedure, stay with me as we explore every aspect, including the benefits, the risks, and what to expect. Let's start with what a varicocele is. A varicocele is an enlargement of the veins within the scrotum caused by improper blood flow. It's common, affecting about 15% of all men and up to 40% of men with infertility. Varicoceles can cause a dull, aching pain, swelling, or even affect sperm production and testosterone levels. Left untreated, it can lead to testicular shrinkage or impaired fertility. Microsurgical varicocelectomy is considered the gold standard treatment for varicocele. Using an operating microscope, the surgeon isolates and ligates the abnormal veins while preserving the surrounding structures such as arteries, lymphatic vessels, and the vas deferens. This precision significantly reduces the risk of complications. The procedure is performed under general or regional anesthesia. A small incision of about 2-3 centimeters is made in the groin, through which the problematic veins are accessed and tied off. Healthy veins take over the blood flow, ensuring proper circulation. The procedure typically takes 1-2 hours, and patients are often discharged the same day. Now let's discuss the benefits. Studies show significant improvements in semen parameters, such as sperm count, motility, and morphology, within 3 or 6 months after surgery. Many men report relief from scrotal pain, and for some, testosterone levels increase, enhancing hormonal balance and overall well-being. Importantly, microsurgical varicocelectomy has the lowest recurrence rate among surgical options, making it the most reliable choice. However, no surgical procedure is without risks, and it's important to address the potential adverse effects comprehensively. After microsurgical varicocelectomy, some patients may experience mild swelling or bruising in the scrotum, which usually resolves within a few days. Pain is typically minimal and can be managed with over-the-counter painkillers like paracetamol or ibuprofen. In rare cases, more serious complications can occur. Hydrocele formation. This is the accumulation of fluid around the testicle and occurs in a small percentage of cases. It may require further intervention if it doesn't resolve on its own. Infection. Though rare, surgical site infections are possible and can be treated with antibiotics. Hematoma, internal bleeding, can lead to a collection of blood in the scrotum, causing discomfort and potentially requiring drainage. Testicular atrophy. Though extremely rare, damage to the testicular artery can result in reduced size and function of the testicle. Chronic scrotal pain. Some patients may experience ongoing pain post-surgery, which might require additional treatment. Nerve damage. Temporary or permanent numbness in the scrotal area can occur in rare cases. Recurrence. Although the recurrence rate is very low with microsurgical varicocelectomy, it is not zero. Recovery from microsurgical varicocelectomy is typically smooth. Most patients can resume light activities within a day or two and fully recover in about 2 weeks. Strenuous activities, including exercise or heavy lifting, should be avoided for about 2 to 4 weeks. Following your surgeon's post-operative care instructions is crucial to ensure the best outcomes. For those considering this procedure, consultation with an experienced urologist or andrologist is essential. Together, you'll assess the severity of your varicocele, your symptoms, and your fertility goals to determine the best course of action. To summarize, microsurgical varicocelectomy is a highly effective, precise, and reliable treatment for varicocele. It's designed to alleviate symptoms, improve testicular function, and enhance fertility outcomes. If you're facing varicocele or have questions about your reproductive health, I encourage you to reach out to a specialist. Thank you for joining me today. If you found this video helpful, please like, share, and subscribe to Ask Fabio for more insights into urology and andrology. See you in the next video.